Welcome to another Doctor 2 Health Mastery series. Today we'll be talking about Polycystic Ovarian Syndrome. Before we get started, most of you that watch my video are not actually subscribed to my channel. Please subscribe, like, share it with your friends and family. It really helps me to make more of these videos. Polycystic Ovarian Syndrome, otherwise known as PCOS, is a chronic disorder, the cause of which is complex and poorly understood. It is associated with difficulties getting pregnant, adverse pregnancy complications, increased risk of cardiovascular diseases and metabolic complications such as type 2 diabetes. It is thought to be driven by insulin resistance. Essentially, this means the body needs a much higher levels of insulin in order for insulin to do the work that it normally does. It therefore results in excessive circulating insulin, a condition known as hyperinsulinemia. Another key driver of PCOS is thought to be excess circulating androgens. These are testosterone and similar hormones. The excess insulin and excess androgens all interplay in a very complex system between the pituitary gland in the brain, the adrenal glands just above the kidneys, the ovaries and fat cells in the body, leading to the symptoms that are seen in Polycystic Ovarian Syndrome. A diagnosis of Polycystic Ovarian Syndrome is made when 2 out of 3 of the following exist. 1. An infrequent or irregular menstrual cycle. This is usually classified as menstrual cycles that last longer than 35 days, or a single menstrual cycle in a calendar year that lasts longer than 90 days. Secondly, clinical or biochemical signs of excess androgens. These are the testosterone-like hormones that I mentioned, and we'll talk about the symptoms that this can cause in a little while. Thirdly, excessive ovarian cyst, known as polycystic ovaries. On transvaginal ultrasound scan, girls and women who have never been sexually active are recommended to have transabdominal ultrasound scan. It is worth stating that polycystic ovaries in themselves do not confer a diagnosis of polycystic ovarian syndrome. In fact, about 25% of women have polycystic ovaries. About 1 in 10 women are affected by polycystic ovarian syndrome, and the general feeling is that this is a gross underestimation of the actual prevalence of polycystic ovarian syndrome worldwide. Polycystic ovarian syndrome tends to affect women between the ages of 19 and 39 years old, but it can present at any age in a premenopausal woman. Some of the risk factors for polycystic ovarian syndrome include a family history of polycystic ovarian syndrome, being overweight or clinically obese, that is a BMI or body mass index of greater than 30, although cutoffs vary depending on your ethnicity, having a history of type 2 diabetes, and having metabolic syndrome. Now let's talk about the symptoms a woman with polycystic ovarian syndrome may develop. The actual symptoms will depend on which of the 3 key diagnostic criteria a woman presents with. In women with infrequent or irregular period, they'll generally notice that their cycle length is longer than 35 days. And if this happens repeatedly, then this should raise the suspicion of polycystic ovarian syndrome. Alternatively, just even having 1 cycle length that is longer than 90 days in a calendar year should raise the suspicion of polycystic ovarian syndrome. Now, if a woman has signs of excessive androgen circulation, remember androgens are testosterone and other similar hormones. These women may develop excessive facial acne, excessive facial hair growth, female pattern baldness, which generally presents as a generalized thinning of the hair with maintenance of the hairline. Additionally, if a woman has these symptoms and they're gaining weight or they're overweight or clinically obese with a BMI of greater than 30, then the possibility of polycystic ovarian syndrome should be entertained. Now, the third factor is having multiple cysts in the ovaries. A woman will not know whether they have multiple cysts in the ovaries. However, if they present with infrequent or irregular period or features of excessive androgen circulation, this should prompt the need to do a transvaginal ultrasound scan or a transabdominal ultrasound scan in a child, a young lady, or an adult woman who has never been sexually active. Women with polycystic ovarian syndrome tend to be overweight or clinically obese compared to women without polycystic ovarian syndrome. And amongst women diagnosed with polycystic ovarian syndrome, the higher their body mass index, the more severe and more widespread their symptoms are. The following infographic illustrates the different body organs that are affected by polycystic ovarian syndrome, which can give you a clue as to the different symptoms that a woman may develop. When it comes to making the diagnosis of polycystic ovarian syndrome, it is important that other conditions that can also cause these symptoms are firstly excluded. As a result, polycystic ovarian syndrome is a diagnosis of exclusion. Some of the conditions that often need to be excluded are, for example, underactive thyroid, otherwise known as hypothyroidism, excessive prolactin secretion by the pituitary gland in the brain, which can cause a woman to stop having periods or to have very infrequent or irregular periods. Another condition that is not so common is something known as Cushing's syndrome, which is related with excessive cortisol hormone secretion by the adrenal gland, and this can lead to insulin resistance. A transvaginal ultrasound scan is necessary to examine the ovaries for the presence of multiple ovarian cysts, as well as to examine the lining of the uterus, the lining of the womb. One of the consequences of not having a period for long periods of time, especially greater than 90 days, is an increase in the cellular turnover of the lining of the uterus, something known as endometrial hyperplasia, which can lead to endometrial cancer. On an ultrasound scan, the ultrasonographer can tell whether the lining of the uterus is thickened beyond the normal level. And if that is the case, then that particular woman would need to have a biopsy of the lining of their womb. When you present to your GP in the first instance, some of the tests that will be done will include checking prolactin level, doing a pregnancy test, because a common reason for not having a period for a long time, for up to 9 months, is falling pregnant. Thyroid function test. Underactive thyroid can also cause facial hair growth. We would also usually check luteinizing hormone and follicle stimulating hormone, as well as estrogen levels. An elevated follicle stimulating hormone is seen in someone who develops menopause, and menopause can develop prematurely. A woman who develops the menopause before the age of 40 is referred to as having developed premature ovarian failure. We also usually check the total testosterone level, as well as the free testosterone or free androgen index. This gives an idea as to the level of circulating androgen levels. In polycystic ovarian syndrome, we'd expect the testosterone level or the free androgen index to be slightly raised. However, if the testosterone or the free androgen index is really high, this should raise the suspicion of a possible tumor that's secreting excessive testosterone. And this should warrant further investigation of the adrenal glands and the ovaries, looking for tumors that may be the cause of this. I mentioned earlier that a transvaginal ultrasound scan is done in women who have been sexually active in the past. The usual criteria for polycystic ovary is having at least 20 follicles in one or more ovaries. Now, if a transabdominal ultrasound scan is done, such as in a young girl or a woman who has never been sexually active, then the presence of 10 or more follicles in one or more ovary is diagnostic of polycystic ovary. So to put this all together, the criteria that is used to diagnose polycystic ovary is called the Rotterdam criteria. So having the presence of 2 out of 3 of excessive circulating androgen levels, infrequent or irregular periods, and polycystic ovary on ultrasound scan. Amongst women who are diagnosed with polycystic ovarian syndrome, 60% tend to have blood tests in keeping with excess androgen levels. The treatment of polycystic ovarian syndrome is targeted at the symptom that the woman presents with. For infrequent or irregular period, general lifestyle advice to facilitate a healthier weight in women who are overweight or obese is really important. Having a healthy, balanced diet, for example, but there's no research supporting any one diet in favor of another diet. Combined hormonal contraceptions are used to regularize a woman's period. If for some reason combined hormonal contraceptives are contraindicated for a woman, then progesterone-only contraceptives can be used. Often these are used to induce withdrawal bleeding, so they're taken for 5 to 7 days every couple of months to ensure that the woman has a withdrawal bleed at least once every 90 days to reduce the risk of endometrial hyperplasia or endometrial cancer developing. The diabetes medication metformin also has a role in the management of polycystic ovarian syndrome. And it isn't because the woman has diabetes, because they usually do not have diabetes, although they are at high risk of developing diabetes. The main reason here is to reduce the insulin resistance. It helps insulin to do what it normally does. This reduces the circulating levels of insulin, which then reduces the interplay between insulin and androgens and the effects that ultimately lead to the symptoms you see in polycystic ovarian syndrome. For excessive facial hair, weight loss is important. Metformin can be helpful. There's a medication called eflornithine, which can be helpful. It may be also useful to use hair removal techniques, such as shaving, waxing. If a woman develops female pattern baldness, then minoxidil can be quite helpful. Specifically for acne management, combined hormonal contraceptives can be quite helpful. Topical anti-acne medicines, such as retinoids or topical antibiotics, can be helpful. Occasionally also, we may prescribe oral antibiotic for a period of time to manage acne. In some instances, spironolactone can be used as an anti-androgen medication to treat acne. Additional anti-androgen medications, there's also something called finasteride, can be used to help with managing acne. For both of these, it is really important that the woman takes adequate contraceptives, as they can have harmful effects on an unborn baby if a woman accidentally falls pregnant. Getting pregnant when you have polycystic ovarian syndrome can be more challenging. It is not impossible. It can take an average 2 years longer for women with polycystic ovarian syndrome to fall pregnant. Managing the infertility or subfertility in polycystic ovarian syndrome requires a healthy, balanced lifestyle, a healthy weight if the woman is overweight or obese. The use of metformin can be quite helpful. If conception is still taking quite long, then the woman might require ovarian stimulation techniques on the fertility clinic. It is usually recommended to refer a woman if they fail to conceive naturally after a year of trying. However, if that woman is 35 years or older, it is important to refer them early, because the older a woman gets, the lower their natural egg reserve, however much that egg reserve was to start off with, the lower it becomes. With any medical condition, there are some long-term prognosis, long-term complications to be aware of. In the case of polycystic ovarian syndrome, there's an increased risk of hypertension. There is also an increased risk of impaired glucose tolerance, meaning you're at risk of developing type 2 diabetes further down the line. There's an increased risk of metabolic syndrome, which can involve developing fatty liver, type 2 diabetes, obesity, or cardiovascular diseases such as hypertension and heart attacks. There's also an increased risk of non-alcoholic fatty liver disease. This is increased fat deposition within the liver, which can affect the function of the liver down the line. There's an increased risk of anxiety and depression, and this may be associated with not being able to control your weight. It may be associated with difficulty getting pregnant. It may be associated with having really troublesome acne, for example. There's also an increased risk of developing obstructive sleep apnea. I mentioned earlier that if a woman has really long cycles, especially going for longer than 90 days without having a period, this can increase a woman's risk of endometrial cancer or cancer of the womb. Given all of these various risk factors, it is really important that women with polycystic ovarian syndrome are regularly monitored for these various conditions or risk factors that can lead towards the development of these conditions. But it's also important that you're aware of what these risks are, so that you can take actions within your control to help reduce your risk, or to present early to your doctor if you develop any symptoms that may suggest any of these conditions that I've mentioned. I also want to highlight the pregnancy-related complications in the context of polycystic ovarian syndrome. A Swedish study from a few years ago noticed that when women conceived naturally, the chances of delivering, if you have polycystic ovarian syndrome, is about 55%. For women without polycystic ovarian syndrome, the chance of delivering a baby if you fall pregnant naturally is almost 74%. So you have a much better chance of delivering if you do not have polycystic ovarian syndrome. In the case of assisted conception, so for example, the use of IVF or in vitro fertilization, it doesn't really matter whether you have polycystic ovarian syndrome or do not have polycystic ovarian syndrome. Your chance of delivering after conceiving through these methods is about 80% from the same Swedish study. I always like to leave you with tools about things you can do to help yourself. It is really important that you take charge of your health, and having knowledge is potential power, but what you do with the knowledge is where the true power lies. So if you've been diagnosed with polycystic ovarian syndrome, the first thing you can do to help yourself is have a healthy, balanced diet. Do regular exercise. If you're overweight, or if you have a BMI greater than 30, which in medicine we refer to as obesity, then you should try your very best to reduce your weight by at least 5 to 10%. This significantly improves your symptoms if you have polycystic ovarian syndrome and increases your chances of conceiving if you do plan on having a child. I would also like to emphasize that the key here is having a healthy, balanced diet, but not following any particular diet or fad diet. There is no evidence in the scientific literature that favors one diet over another diet. If your mental health is affected by polycystic ovarian syndrome, please speak to your GP. Please get help. In England, there are lots of services available. You can go through the Mind charity. There is the improving access to psychological therapy in various areas in England that you can contact directly. Speak to understanding friends and family members and seek support groups. And you can find many of these online. Look, I hope this has been helpful to you. I look forward to seeing you again on another Health Mastery series. Please share it, like, subscribe to the channel so that we can keep doing more and more of this.